you, Rebecca. So why are we here today? A big reason that we're here today is because Rhode Island, as is the rest of the nation, is in the midst of an opioid addiction epidemic. Fatal overdose is one tragic consequence of this epidemic, and the state has made considerable strides and is in fact recognized as a national leader in creating a public health infrastructure to keep people alive who experience overdose. And I'd just like to recognize that we have national experts, nationally recognized experts in our state, in the universities in our state, and in the hospitals in our state, who have worked hand in hand with the public health agencies, the state agencies, in creating strategy and policy to address this terrible epidemic. One aspect of this effort is distributing naloxones to individuals at highest risk and their family or loved ones. Pharmacies, hospitals, substance use disorder treatment facilities, Department of Corrections, community-based organizations, and private physician offices throughout the state participate in this effort. Since January 2014, these groups have distributed more than 2,500 naloxone kits to Rhode Islanders. Another key aspect is equipping our first responders with naloxone. In addition to emergency medical responders, law enforcement throughout the state is carrying and using naloxone. And as I mentioned before, this strategy was not created in a vacuum. The Centers for Disease Control, Office of National Drug Control Policy, the American Medical Association, the Veterans Health Administration, among many others, recommend increased availability of naloxone to save lives. Protections in the use of naloxone, as provided by the Good Samaritan Overdose Prevention Act, are therefore bedrock in the state's public health strategy. Saving lives, while imperative, is not enough. Prevention and supports to treatment and recovery are critical, and toward that end, the emergency rooms across the state provide where overdose victims go when EMTs are called, are offered the chance to connect with recovery coaches who support them in entering treatment and serve as an ongoing resource. The first step in accessing these services is that someone at the scene of an overdose feels safe enough, regardless of their situation, to call 911. Allowing the Good Samaritan Overdose Prevention Act to expire undermines years of work to establish these safeguards. We implore our state leaders to develop comparable protections until the legislature can set right the mistake of leaving our state without a Good Samaritan law. Thank you.
Thank you, Michelle. And I just wanted to correct Michelle's title on